Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. And in this video, I'm going to be talking with, well, kind of two groups, one being new dental assistants and one being maybe dental assistants that are changing offices and going to a different general dental office. It could apply to other offices as well, like endo or oral surgery as well, depending on the case. But this video describes kind of perhaps what maybe dentists expect for, say, an emergency setup. That is, what would we want ready to go for an emergency patient that happens to come in? I know I've seen this as a question on some dental assisting sites, so I want to best answer it, at least in my terms, and then give additional tips. So first of all, I'm going to say this. Each and every one of us dentists is unique. So he or she, whomever you're helping as an assistant, whomever you're helping may want to have different things out. So the best way to find out is really to ask who you're working with. So, one person may just want a basic set. One person may want everything under the sun. You never know. So that said, direct communication is your best way of finding out what he or she likes, your doc likes, and then going from there. And if there are multiple docs, it may be a good idea is to set up like a cheat sheet. Ask each and every one and then list everything. That way there's no mistaking, hey, it's a back tooth that's broken. I want, basic set, an x-ray, So those are the sorts of things that I would, recommend for you all. So I'll go ahead in a few moments and show you what, for example, I expect when my assistants are getting ready for an emergency patient. But it's basically like they're on cruise control, autopilot. They already know, and I basically walk into the room and everything's ready. So it's a great thing. And so we want you to get to that point. That way it becomes a smooth experience for everybody, for you, the patient, and the doc, and everything can move ahead efficiently and you can help your patient as quickly and best possible. So that said, here is my idea of a basic setup for an emergency. Okay, so as you can see, I always like the basic setup for when I take care of any emergency. So this is an automatic. It'd be pretty much an automatic for any dentist in any dental practice, I would imagine. Yeah, because you really can't do anything without having a mirror. And certainly it's helpful to have an Explorer. And the cotton pliers there are optional. You don't have to have them, but they're helpful. Now, depending on which area the patient calls in with a problem for, you can either have your anterior XCP or you can have your posterior XCP. This is more than likely the one that you're going to have. While it's always possible to have anterior tooth problems, in my experience, the vast majority of issues come with the posterior teeth. So having a posterior XCP, whether it be for film, as these ones are, or for digital, is certainly pretty much a mandatory thing. So those are definitely the things that I like to have whenever there's an emergency. Now, I'm not showing an op kit, but if a patient calls in and says they have a broken tooth, or a filling that's out, then that will also be included in the emergency kit. So there you have it. Those are the items that I would say are basically required for every single emergency at a general dental office. Now that can vary at different offices like endodontic or oral surgery, but this is the basics for the typical run-of-the-mill general dental office. So thank you for joining me on this video about basic setups for emergencies. As I said at the beginning, each and every doc will have his or her preferences. So the important things, I would say, almost 100% of all docs will want a basic set. That is mirror, Explorer, maybe cotton pliers thrown in there, and will want an x-ray. So whether it's an anterior or posterior PA, or in the case of wisdom teeth, a pano, they're going to want that. Maybe cone beam CT. If that's what your office offers, then hey, why not? But those are the basics for emergencies. Now, like I said, each dentist will have his or her well, quirks, preferences, and so they may be asking you for an operative kit. They may be asking you for other stuff ready to go even before the patient arrives. If that's the case, make sure you know what he or she likes and have it ready to go, and that's my best advice for you. So I hope you're all helped by this video, that you found it helpful, and that you're all staying well and healthy out there. Take care.